Hello. My name is Dr. Francois Ricard. I am an osteopath and a PhD. I am director of the International Madrid School of Osteopathy, EOM, and president of the Scientific European Federation of Osteopaths, SEFO. In this series of 2 videos, I am going to present you the diagnostic tests, and the cheapest material to reveal an imbalance of the neurovegetative system. The first video will deal with the tests described from the study of heart rate, blood pressure, and the EKG, to show an imbalance of the neurovegetative system. The second video will deal with the material used to reveal an imbalance of the neurovegetative system, and his analyses. The diagnosis of autonomic disorders relies on the study of the sympathetic and parasympathetic systems, through postural changes, temperature changes, physiological activities and stress. The normal concentration of norepinephrine in urine is 0.5 to 20 micrograms per 24 hours. In blood less than 100 micrograms per milliliter in supine position, and does not increase when standing. Modification of heart rate and blood pressure. Modification of sweating. Pupillary response. First we will examine the table of tests that need the use of material. Polar 10 strap, tensiometer, Kubio software. They allow to diagnose a central sensitization and imbalance of the neurovegetative system. More reliable tests that need material. Deep breathing. The deep breathing test is performed standing up, with the Polar H10 belt. The heart rate is studied with the pulse to obtain data on the parasympathetic cardiovagal reflex, that translates into 10 beats per minute or less. Valsalva maneuver. The Valsalva maneuver is performed standing up with the Polar H10 belt. The heart rate is studied with the pulse and blood pressure. It produces a cardiovagal reflex. There is inhibition of the parasympathetic system. Postural change test, going from supine to standing, head-up tilt test. They allow the study of blood pressure and heart rate, to show an inhibition of the parasympathetic, or a hyperactivity of the orthosympathetic system. Hand grip effort test. In the hand grip effort response test, a handle dynamometer is used. Blood pressure and heart rate are measured, allowing evidence of parasympathetic inhibition, or orthosympathetic hyperactivity. Cold test. In the cold test for the face or hand, a cube of ice cubes, or a cold compress is used. Blood pressure, heart rate and pupillary response, mydriasis, are measured. Also the pain response. It allows to show an inhibition of the parasympathetic, or an overactive orthosympathetic system. Pseudomotor tests. In pseudomotor tests, sweating is measured to show an orthosympathetic hyperactivity. Less reliable tests that do not need material. There are tests that do not need material, but they are less reliable. All these tests can show an inhibition of the parasympathetic, or a hyperactivity of the orthosympathetic system. The Polar H10 belt, and the Kubio software, can be used in the study of the oculocardiac, and solar reflexes. Oculocardiac reflex. The oculocardiac reflex consists of compressing the eyeballs, and studying changes in heart rate with the pulse. The normal reaction is a decrease in heart rate. Solar reflex. In the solar reflex, palpation of the epigastric area changes the heart rate. A mild increase in heart rate is normal. Vascular automatic signal, VAS, by Nogier. The Nogier vascular automatic signal, VAS, test It consists in taking the specific Nogier pulse. It is a modification of the heart rate when touching any part of the body. With the pulse, the VAS is a very slight increase of the force of a pulsation, positive VAS. Vulpian sign and dermographism. When passing an instrument on the skin, a histaminic reaction appears after a few minutes. In the heart rate response test to postural change, the patient is lying supine for 5 minutes, and after getting up, to stand up unaided, as quickly as possible according to their physical abilities. The standing position causes an increase in heart rate that peaks within 3 seconds, followed by a more gradual increase that peaks 12 seconds after the standing position. The initial increase in heart rate is mediated by sudden inhibition of vagal tone, whereas the more gradual increase is due to increased vagal inhibition and increased activity of the sympathetic nervous system. The normal response to orthostatic stress is characterized by a decrease in blood pressure, with recovery after the first minute of the test, and a relative increase in the frequency that allows the maintenance of long-term hemodynamic variables. The abnormal dysautonomic response is characterized by a progressive reduction in blood pressure and pulse, changes in heart rate. The abnormal response is characterized by an exaggerated heart rate response, that is, a sinusal tachycardia to orthostatic stress, associated with symptoms of orthostatic intolerance. It is caused by poor vascular function and a sympathetic hyperactivity state. The vasovagal response determines the sudden onset of hypotension and bradycardia. It is associated with a transient loss of consciousness. There is a decrease in systolic blood pressure, greater than 70 mm of mercury, with or without bradycardia, at less than 60 beats per minute. Shifting from the supine to the upright position results in the translocation of 300 to 800 cubic centimeters of blood from the central intravascular compartment to the legs, buttocks, pelvis, and splanchnic circulation. The sympathetic nervous system, the parasympathetic nervous system, and the baroreflex play a role in this homeostatic response. Protocol for data collection. Patient resting in decubitus for 4 minutes for stabilization. Then 2.5 minutes of data collection in this position. The patient gets up quickly and waits 1 minute for orthostatic stabilization. Then 2.5 minutes of collection in orthostatic position. Total test time 10 minutes. Test on inclination table, head-up tilt test. Orthostatic hypotension is defined as a sustained drop in diastolic blood pressure of at least 10 mm of mercury, or a drop in systolic blood pressure of at least 20 mm of mercury in normotensive subjects. Vasovagal syncope is defined as a sudden drop in blood pressure and heart rate, along with loss of consciousness. Postural symptoms of orthostatic tachycardia are defined as a sustained increase in heart rate of at least 30 beats per minute, or a heart rate of at least 120 beats per minute, in the first 10 minutes of tilt, without concomitant orthostatic hypotension. Test protocol on inclination table, head-up tilt test. Rest for 5 minutes. Baseline heart rate and blood pressure are averaged 40 seconds to 10 seconds prior to incline. The table is then slowly tilted vertically at an angle of 70 degrees, for up to 20 minutes. The patient is asked to report all symptoms, and the test is stopped when orthostatic symptoms or pain become intolerable. A. The normal response to orthostatic stress is characterized by a decrease in blood pressure, with recovery after the first minute of the test, and by a relative increase in the cardiac frequency that allows the maintenance of long-term hemodynamic variables. The abnormal dysautonomic response is characterized by a progressive reduction in blood pressure and pulse frequency, without changes in heart rate. B. The abnormal response is characterized by an exaggerated heart rate response, that is sinusal tachycardia to orthostatic stress, associated with symptoms of orthostatic intolerance, caused by poor vascular function, and sympathetic hyperactivity states. C. The vasovagal response is determined by the appearance of hypotension and bradycardia, associated with a transient loss of consciousness, and with a decrease in systolic blood pressure greater than 70 mm of mercury, with or without bradycardia, less than 60 beats per minute. Response of blood pressure to hand gripping effort. Ewing and Clark, 1982, introduced the sustained grip test as a standard that is part of a battery of tests used to diagnose diabetic cardiac autonomic neuropathy. First, the subject is asked to press the grip of a handle dynamometer with full force. Then the closing contraction of the hand should be maintained for 3 to 5 minutes at 1/3 of the maximum contraction force. Increased sympathetic activity and vasoconstriction induce an increase in blood pressure that reflects sympathetic autonomic activity. Hiltz, 2002. The early acceleration of the heart rate during the maneuver is due to a decrease in vagal activity, while the late acceleration of the heart rate is the result of sympathetic activation. Cold test. In the cold test, the patient immerses one hand in ice water for 1 to 2 minutes, while monitoring the heart rate and blood pressure. This produces a reflex increase in both heart rate and systolic blood pressure, as the activity of the sympathetic nervous system increases. The response of blood pressure to cold water immersion can be used to measure sympathetic function. This test increases heart rate, blood pressure, and sympathetic muscle activity. The cold test induces a significant mydriasis, plus 23.9%, after 30 seconds, followed by a meiotic phase that reaches the maximum degree, minus 21.8%, during the last minute of the test. It also tests for central pain sensitization. Cold test of the face. The cold test on the face consists of applying a cold compress, 1 degree Celsius to 2 degrees Celsius, on the forehead and maxillary region of the subject's face for a period of 60 to 180 seconds according to Hiltz et al., 1999. Cold stimulation of the forehead and maxillary region activates the parasympathetic, sympathetic, and peripheral cardiac nervous systems. The combined activation induces a decrease in heart rate, as well as peripheral vasoconstriction with a consequent increase in blood pressure. Oculocardiac reflex. The oculocardiac reflex is a reliable tool to detect a dysfunction of the neurovegetative nervous system. There is a decrease in pulse rate, associated with traction applied to the extraocular muscles or compression of the eyeball. Sympathicatonia. In case of sympathicatonia, during the 4 seconds of pressure of the eyeballs, the pulsations decrease in intensity. The pulses collapse under the fingers, and, sometimes, in frequency. But, in case of sympathicatonia, the return to baseline in less than 4 seconds as soon as pressure is released. In case of hypersympathicatonia, the reflex is reversed. The pressure increases the pulsations, and can even accelerate them. Parasympathicatonia, Vegatonia. In the case of parasympathetic atonia, from the onset of ocular pressure, the pulse decreases in rhythm and intensity. In the case of vagatonia, the return to the initial state takes more than 4 seconds. The longer the time, the greater the vagatonia. The oculocardiac reflex is easily explained. Pressure on the eyeballs causes vagal stimulation, hence the slowing of the pulse, and the return to normal after this stimulation has stopped. Solar reflex. In the study of the solar reflex, palpation of the epigastric area modifies the heart rate. In normatonia, there is a smooth increase in heart rate. If the sympathetic predominates, there is a significant increase in heart rate. While, in case of predominance of the parasympathetic, there is either a maintenance or a decrease in heart rate. Nogier vascular automatic signal, VAS. Nogier's VAS, or vascular autonomic signal, uses the modification of the heart rate by touching any part of the body. In the case of normatonia, a sensation appears that the beat of the radial artery stays stronger while the cutaneous stimulus lasts. If there is a predominance of the sympathetic, the sensation is that the strongest point of the radial pulse goes distally. If there is a predominance of the parasympathetic, the sensation is that the strongest point of the radial pulse goes proximally. Vulpian sign and desmographism. To look at for the Vulpian sign, that is, a dermographism, we pass an instrument over the skin of the arm, abdomen or back, and we observe if after a few minutes a welt, wheal, or a red and swollen line appears. The Lewis triple response is a skin response that occurs by firmly stroking the skin, resulting in an initial red line, followed by a breakout around that line, and finally a welt. It is due to the release of histamine. In the case of normatonia, a white signal appears followed by a normal pink skin response after 30 seconds. In case of predominance of the sympathetic, an intense red signal appears in less than 30 seconds. If the parasympathetic predominates, a white signal appears that lasts for more than 60 seconds. End of the part 1. Thank you for listening.